midwives, they attended the royal birth, so does that mean a midwife should attend yours too? Michal Klau-Stevens is the birth lady. She joins us this morning to share more about the care that midwives provide. Michal, the birth lady, nice to have you here.
Thank you.
Kate Middleton, we were all talking about 10 hours after she gave birth to baby Charlotte. She walked out looking fabulous.
Fantastic.
How?
Well, she had a hairdresser on call, you know, and a stylist, but I also think it had a lot to do with the kind of care that she received. She was attended by midwives who really work to maintain the normal, healthy birth process, and you can see the results.
Right, she wasn't, I mean, you could tell that just by the way that she came out 10 hours later in Jimmy Choo high heels, that she wasn't swollen.
Right, that was a big indicator. She was wearing these fabulous heels, and her feet fit into them, and she was moving easily. So, to me, that meant that she probably didn't have certain interventions, like intravenous fluids or an epidural, that would affect the amount of fluid in her body.
Right, exactly. But the important thing to note is our goal is not to look that fabulous 10 hours after birth. Our goal is to have a healthy child and to feel good.
Right.
So midwives do provide that care, that step-by-step care through pregnancy and delivery. Tell us about what a midwife does.
A midwife is a person who's trained to attend women in childbirth, but they really focus on what's normal and healthy. And they also focus on the physical, the psychological, and the social aspects of childbirth, and work to maintain just a normal, healthy pregnancy.
So throughout the pregnancy, they're there, and they will help you in different ways than a doctor might, and they take a different approach. Now, how can we know if a midwife could be the right care provider for us as an individual?
The main thing is if you're healthy and having a normal pregnancy. Almost over 80% of women would qualify for care with a midwife.
Right, and if you're not, then maybe you want to go with a doctor. And because a doctor is a surgeon. I mean, they...
Right, obstetricians are surgeons, so they really focus a lot on,
well, the medical, well, I think it's different because
they focus on fixing things when they are not going as planned.
Okay.
That's what their specialty is.
Right. So when things don't go as planned, they know what to do.
Right.
And not that a midwife doesn't, but midwives focus on making everything right and staying positive and healthy throughout.
Right.
But the important thing to note is if you have a midwife as your care provider and something were to go wrong in the process, there's always a doctor there that can jump in.
Right. And midwives themselves are able to do certain interventions also. So you don't necessarily have to change care if you need an induction or if you want an epidural or if you want some other kind of pain relief. A midwife can take care of those things too.
Right, exactly. And so if you are having that healthy pregnancy and you know that you want that really, you know, close care, then a midwife might be the right choice for you.
Right.
And I think, too, we also think of midwives as being the ones that do not let you get an epidural and do not let you be induced. But it's different now, where it's more on the focus of care and not necessarily what they will allow you to do.
Right. Well, you always want to have care that's appropriate for what your medical needs are.
Right.
That's really the main focus. So if you need something more, then they can help you with that. But if you really want to focus on a natural birth, if you don't want to have a lot of interventions, you want to have an active birth, a midwife is really a great care provider for those types of births.
And May is when International Day of the Midwife takes place, so it's a great time to talk about it. Thanks so much, Michal, the birth lady. Nice to talk to you about this.
Yeah, thank you.